Have you noticed that your gut isn't functioning normally? Excess gas, abdominal bloating, or even changes in your bowel habits, these could be warning signs from your body. Many people still think that colon cancer only affects older individuals or those with a family history. But the reality is different. This type of cancer has been rising alarmingly among people under 50, including young adults. And the big issue is that in most cases, the disease is only discovered when it's already in an advanced stage. That's because early signs can be subtle, and unfortunately, many people ignore the warnings their body is trying to send. Today, I'm going to show you 7 warning signs of colon cancer that almost no one talks about. Even better, I'll explain how to prevent this disease, which tests can save your life, and even a simple test to find out if your gut is inflamed. Here on this channel, you'll learn how to take care of your body in a holistic way. I reveal the truth behind many illnesses, truths that often no other doctor will tell you. So take advantage of this opportunity, subscribe to the channel, hit the bell below to get notifications for new videos, and leave a like so YouTube knows this content was useful to you. The gut and its importance for health. We usually think of the gut as just a digestive organ. And yes, it's crucial for digesting and absorbing nutrients like vitamins, minerals, magnesium, sodium, potassium, vitamin B12, vitamin C, and more. These nutrients are delivered to cells to produce energy and maintain overall health. But the gut is much more than that. It's also known as the body's second brain. Ever heard that phrase? That's because it's responsible for producing various hormones, like serotonin, the famous happiness hormone. The gut also plays a key role in immune function and even mental health. That's why a healthy gut means a person who is more energized, in a better mood, less anxious, and at a lower risk of chronic inflammation. An inflamed gut, on the other hand, can lead to fluid retention, bloating, headaches, acne, fatigue, dry skin, mood swings, allergies, and much more. More importantly, an inflamed gut can increase the risk of colon and rectal cancer, which kills thousands of people every year. The 7 warning signs of colon cancer. 1. Changes in bowel habits. The gut has its own natural rhythm. Some people go once a day, others twice, and some go every other day, especially those who practice intermittent fasting. That's okay, as long as it's your usual pattern. The problem arises when this rhythm suddenly changes. Episodes of constipation or diarrhea that come and go without a clear reason are a red flag. Studies show that about 65% of patients with colon cancer had changes in bowel movements. If this has been happening to you for weeks, it's time to investigate. So, what's considered normal? Ideally, you should have a daily bowel movement with soft, sausage-shaped, evenly brown stools that pass easily without excessive wiping. We use the Bristol stool scale to evaluate this. Type 4 is considered ideal. Very hard stools, small pellets, very watery stools, streaks, or very dark colors may signal something's off. 2. Blood in the stool. Always check your stool when you go. Bright red blood often points to hemorrhoids, but very dark stools with a strong odor could indicate digested blood, a possible sign of cancer. In that case, a fecal occult blood test is recommended. Simple, inexpensive, and highly effective for detecting microbleeding. 3. Frequent abdominal pain. Many people normalize abdominal pain, thinking it's just gas or poor digestion. But if you're having frequent cramps or pain, especially when going to the bathroom, pay attention. A tumor can cause inflammation or partial blockage in the intestine, leading to persistent pain. 4. Constant fatigue and exhaustion. Feeling drained and low on energy, even after a good night's sleep. This could be anemia from internal bleeding, which is common in certain cancers. In this case, check your iron and hemoglobin levels with a simple blood test. 5. Persistent bloating and gas. Feeling bloated, constantly gassy with a swollen belly, and no clear cause is another warning sign. This is different from the immediate reaction you might get after eating lactose, for example. If this discomfort is ongoing, it may suggest abnormal fermentation of food due to changes in gut flow. 6. Unexplained weight loss. If you haven't changed your diet, started working out, or begun fasting, but you're still losing weight, pay attention. Cancer can impair nutrient absorption and decrease appetite. If you've lost more than 5 kg, 11 leaves without any apparent reason, investigate. 7. Feeling of incomplete evacuation. If you go to the bathroom but feel like you didn't finish, you might be experiencing rectal tenesmus. This symptom, sometimes accompanied by thin or ribbon-like stools, can indicate a tumor blocking complete evacuation. Life-saving exams, fecal occult blood test, colonoscopy, especially if you're over 45 or have multiple symptoms, CT scan to identify masses, thickening, or other abnormalities, how to prevent colon cancer. Eat fiber-rich foods, fruits, vegetables, oats, seeds. Note, people with diverticulitis should avoid seeds. Drink plenty of water. A hydrated gut works better and prevents hard stools. Avoid processed and cured meats such as sausage, hot dogs, ham, and salami, all linked to higher cancer risk. Include turmeric in your diet, a natural anti-inflammatory that protects gut cells. Avoid alcohol and smoking, both drastically increase cancer risk. Consider magnesium supplementation, great for bowel function. Recommended doses range from 400 to 800 milligrams/day, always with professional guidance. Now that you know these warning signs and how to prevent them, share this content with someone who might need it. Information saves lives. And remember, take care of your gut. It takes care of you. Yeah, I get it. AI can be a little intimidating, but think of me like a superpower you didn't know you had.